Just by a show of hands, could I get an idea of how many of you have contact or work with or work at the U of M health system? How many of you have contact, work with, or work at the St. Joe's health system? Okay. So this is really for everybody in the room. I know we've had questions ourselves about what is going to happen in the U of M and St. Joe's health systems. Who are we going to refer people to? What are we referring them for? What kind of advice can they get? What's going to happen with new people who come in? What about the person who, all of a sudden has a heart attack on October 5th? And so anyway, today I have with us Karen Harold and from the U of M Health System and Tammy Stryker from St. Joseph Mercy Health System, and they're each gonna, I think we'll just have each of them talk for a few minutes, and then we'll open it up to questions for both of them, okay? And Karen's got handouts, Tammy's got PowerPoints. I am Karen.
Good afternoon. I decided not to bore anyone with PowerPoint, so I just had a couple of pieces of paper that I wanted to pass out. So we have decided to become certified application counselors at University of Michigan Health Systems. So there are 17 financial counselors, and we have 11 registration staff that's going to help us out as needed. So if you notice, you'll have these in your packet. What it includes is the counselor's hours, which are Monday through Friday from 8 a.m. to 5 p.m. But the phone hours are 9 to 4. So they're available to see patients until 5 o'clock if they come in for walk-ins, but on the phones it's until 4 p.m. I have attached their phone numbers. I do have the email address available if anyone needs that. I didn't put it on the slide though. And so we also have counselors available at 8 different locations throughout the health center, and I have them listed. We recently received an area for a counselor in the emergency room department, whereas before we didn't have that. So we will have someone there to assist patients as needed. So when patients come in, we're still learning all of this. We don't know what to expect. We don't know how many people we're going to be presented with, but we're going to try and do our best to assist the patients as needed. Anybody have any questions for me?
So if we have someone, we work with older adults. So if we have someone between the ages of 60 and 65, they come into us and say, what do? We can send them to you, or only if they're U of M patients already?
No, we'll assist anyone. We'll try and get anyone signed up for the marketplace. We will try and assist them in any way we can. So if they're coming to us and they've never been seen by U of M or they're in a different county, we will still try and assist these patients to get them signed up for insurance.
One other thing, Karen, is that we are also establishing work queues of patients that have upcoming appointments.
Thank you.
We'll be proactively contacting people who are uninsured or Washtenaw County Health Plan, or those that we know are coming into the facility. So we'll have some staff that are making outbound calls to make connections.
Thank you, Mary Ann, for saying that, because I did want to say also that we're trying to proactively identify patients that's uninsured before January, so we can start making phone calls and try and assist those patients.
Can people walk in or by appointment only?
Either or. If they contact us, we may ask them if they want to make an appointment, but really we're here to serve the patient, so whichever is convenient for the patients.
So how are these eight locations chosen? I mean, Chelsea Family Practice is a big U of M, but it's kind of out county area, but I see they're not on the list.
No, so these are counselors that we already have strategically placed in these locations. They've already been inside the clinics. So we have staff on levels 1, 2, and 3 in Taubman, the Taubman Health Center, and then the cardiovascular. So it's places that they've already were established prior to the market.
And I think that Doug had talked about reaching out to some of the health centers that have patient reps that already do this kind of work. And I think Chelsea's one of them, I think, the next, Chelsea.
Oh,
I think
that is
so,
correct.
we're gonna, that hasn't been done yet, but our hope is that they could become certified education coordinators as well.
I want to pass this out to the other people in my unit, which is visiting care. But it says counselors are available. What does it mean? I want to kind of direct them. What's the name I should put on the top? And these are
They're patient financial counselors.
these are patient financial.
Yes, yes. Yes, Anita.
Karen, what if the person in the emergency room, is that Monday through Friday
Yes, it is.
during the day?
Yes, we don't know what the hours are gonna be currently because she's gonna start there within the next month. So we know for right now it's until 5:30.
So is the intent then that she'll follow up on everyone that comes through off hours too, or have you not gotten to that point?
We haven't gotten to that point yet.
That's what we need to do.
Is that okay, so the ED staff. So Betty is here, my counterpart, and so she has staff, that's the registration staff in the emergency room. So will they provide cards or they're gonna assist them to a certain point and then it'll be a handoff to the patient financial counselor for the next day?
And then follow up?
Yes.
Great.
You mentioned an email address.
So it is pfc-counselors@med.umh.edu. Thank you.
And like all things, Karen mentioned to me that as she started thinking about this, she started having all kinds of questions herself. So the procedures will be evolving. Yes. Tammy, come on in.
Hi, good afternoon, everybody. I'm Tammy Stryker. I'm the manager for the patient financial counseling team at St. Joseph Mercy. Thanks for asking me to come over and chit chat about it. It seems like this is all we're talking about right now at St. Joe's. It's all around us. We do have 16 people who will be enrollment specialists. St. Joe's decided to withdraw our certified application counseling application because we felt and it would be in the best interest of the patient if we didn't have certain restrictions that may have impacted our team with. But we still are capable of assisting them from creating their account all the way through to enrollment. We've had all of the training. My home staff is now fully trained. We just don't have the title certified application counselor. So we will have 3 people out at our Chelsea site, 2 people at Livingston, and we have 9 financial counselors at the Ann Arbor, Maine. And we will work remotely with our other locations and of course all of the walk-ins that we will be seeing on a regular basis. Some of the outreach opportunities that we have taken is to provide an in-reach letter to our current self-pay and charity population. Just to kind of give you a number on that, we have 47,000 that we've seen in the last fiscal year at all of our locations. It's quite astonishing. But we will be sending them a letter and encourage them to come on in, 40,000 people, and let's talk about health exchange enrollment. We're gonna rock your world. So that is one of the outreach opportunities we have, and we're taking it fully to the max that we can. My counselors are like, yeah. And then, I don't know if any of you got to see it, we had a special report on ABC Healthcare Reform 101. That aired last night on Channel 7, 8 o'clock. It'll be airing again on September 27th at noon. If you want to tell patients to kind of watch that, it kind of gives them a heads up. And it's just a summary of what's to expect. The cool thing that happened last night is when we ran it, we had live chat with our president of CHE Trinity. It's a new title. And Mary Dufree from IHA, who were very wonderful answering questions that were coming in during the whole hour special. And we were watching it live, and as they were answering questions, they were calling our phone call center, and the calls were coming right to my team. So we took 37 calls in 37 minutes. It was exciting, and it was really great just to get some feedback from the patient population. What are they asking? What do they want to know right now? What can we do today? And as you all know, not a whole lot until it's live. But one of the other outreaches we have is our academic clinics. We have the AIM clinic and our OB clinic. We will have counselors located in the Riker building for those clinics where patients will come in and can be referred by all the social workers and case managers to come down, set up an appointment. We are driving it by appointment. We really do want to meet face-to-face with the patient. We'll take walk-ins, but if you did want to refer, we would like to schedule that appointment. And I'll provide a number you can call, and we'll get that set up for anyone who does want to call us. We also have a financial counselor at our neighborhood family clinic, and we are partnering with the United Way and the WHI partners to help reach out and send people where they need to go when they need to get there. Where did they go back? Okay, so that's some of our outreach opportunities. One of the things that we did do is we did remain a champion for coverage at the CMS website. And if patients want to check out and learn anything they want to know about the ACA, our website is the www.stjoeshealth.org/ACA. If they want to call and talk to a counselor, they can call the 1-855-SJ-DISCOVER. It's really Discov, but you know, they just keep those extra letters there. I'm just like, so it stops at the V. So who will be doing the enrollment? My team, along with several people who have volunteered to help work with us during this 6-month enrollment period. And I already identified the serving locations and the referral process. The best way to refer a patient to us is through that phone number, because we are tracking it, and it will go to operators that are prepared to answer and triage those calls and get them to us and what they need at that time. Any questions?
Will you guys have counselors that can speak in Spanish or other languages to assist?
We have the Syro Blue phone. We will be able to talk to them if we need to with an interpreter on the phone.
So I'm a little confused. What's the difference between the type of counseling that they'll be able to provide and this actual CAC?
Well, the CAC agreement is signed by your hospital, and where you enter into an agreement with the CMS agreeing to their requirements. Where we did the training, we just decided to withdraw our application to be CACs. Because if we did breach that contract in any way, it would be held against us.
And will be able to provide the same type of opportunities?
Absolutely. We'll be limited in some of the things we can see online, but we can still walk them completely through the entire process that we would have in any other
So CAC
format.
may be able to see the application information for that.
No, if we're working with them, we'll see it too. We'll keep the privacy practice laws that we already have. And the thing with St. Joe's, and you probably don't know this, is a lot of times we're working with those patients who are right in our house right that day. So a lot of times they're coming to us for charity care, so we're already starting an in-depth process with them. So for us, it's a little bit different, where if you're an off-site location. So we abide by that law anyways, but we just don't have the title. Any other questions? Okay, well, thank you so much for having me.